In this video you will know about the types of diabetes. Type 1 diabetes. Type 1 diabetes is a chronic autoimmune disease that affects the pancreas, resulting in the inability to produce insulin. Insulin is a hormone that regulates blood sugar levels, allowing cells in the body to use glucose for energy. Without insulin, glucose accumulates in the bloodstream, leading to a range of symptoms and complications. Symptoms of type 1 diabetes: increased thirst and urination, extreme hunger, fatigue and weakness, blurred vision, unexplained weight loss, irritability and mood changes. 7. Frequent infections and slow healing of cuts and bruises. Causes of type 1 diabetes. Type 1 diabetes is caused by an autoimmune reaction that destroys the insulin-producing cells in the pancreas. The exact cause of this autoimmune reaction is not well understood, but genetic and environmental factors are believed to play a role. Type 2 diabetes. Type 2 diabetes is a chronic metabolic disorder that occurs when the body becomes resistant to the effects of insulin or the pancreas does not produce enough insulin. Insulin is a hormone that regulates blood sugar levels, allowing cells in the body to use glucose for energy. Without insulin, glucose accumulates in the bloodstream, leading to a range of symptoms and complications. Symptoms of type 2 diabetes: increased thirst and urination, fatigue and weakness, blurred vision, slow healing wounds, tingling or numbness in the hands or feet. 6. Recurrent infections, such as thrush or urinary tract infections. Causes type 2 diabetes. The exact causes of type 2 diabetes are not fully understood, but genetic and environmental factors are believed to play a role. Gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy. It occurs when the body cannot produce enough insulin to regulate blood glucose levels during pregnancy. This can cause high blood glucose levels, which can affect both the mother and the baby. Symptoms of gestational diabetes: increased thirst and urination, fatigue and weakness, blurred vision, nausea or vomiting. Causes of gestational diabetes. The exact cause of gestational diabetes is not well understood, but it is believed to be related to hormonal changes that occur during pregnancy. These hormonal changes can make it more difficult for the body to produce enough insulin to regulate blood glucose levels. Monogenic diabetes. Monogenic diabetes is a rare form of diabetes caused by genetic mutations that affect the body's ability to produce or process insulin. It can be inherited in an autosomal dominant or recessive manner, and its symptoms and severity can vary widely depending on the specific genetic mutation involved. Symptoms of monogenic diabetes: increased thirst and urination, fatigue, blurred vision, slow healing wounds or infections, weight loss, in some cases. Causes of monogenic diabetes. Monogenic diabetes is caused by mutations in genes that affect insulin production or processing. These mutations can be inherited from one or both parents or can arise spontaneously. Prevention. As monogenic diabetes is caused by genetic mutations, there is no known way to prevent it. However, individuals with a family history of the condition may benefit from genetic testing and counseling to determine their risk of developing the condition and to make informed decisions about family planning. Cystic fibrosis-related diabetes, CFRD. Cystic fibrosis-related diabetes, CFRD, is a type of diabetes that occurs in people with cystic fibrosis, CF, a genetic disorder that affects the lungs, pancreas, and other organs. It is estimated that up to 50% of people with CF will develop CFRD by the time they reach their 30s. Symptoms of cystic fibrosis-related diabetes, CFRD: increased thirst and urination, weight loss or failure to gain weight, fatigue and weakness, nausea or vomiting. Causes of cystic fibrosis-related diabetes, CFRD. CFRD is caused by the same underlying genetic defect that causes CF. This defect affects the pancreas, preventing it from producing enough insulin to regulate blood glucose levels. The risk of developing CFRD is higher in people with CF who have poor lung function, chronic infections, or who are undernourished. Drug-induced diabetes. Drug-induced diabetes refers to diabetes that is caused by certain medications. Some drugs can cause the pancreas to produce less insulin or make the body less sensitive to insulin, leading to high blood glucose levels. Causes of drug-induced diabetes. The medications that can cause drug-induced diabetes include corticosteroids. These drugs are used to treat inflammation and immune system disorders. Antipsychotic medications. These drugs are used to treat mental health conditions, such as schizophrenia and bipolar disorder. Antiretroviral medications. These drugs are used to treat HIV, AIDS. Diuretics. These drugs are used to treat high blood pressure and heart failure. If you want to know more about diabetes, then click a link given in a description.